Hi guys, this is Jason Williams DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to visit with you about sauna. It's cold weather where I live right now, and sauna sounds like a nice relaxing way to get out of the cold. If you've watched some of my prior videos, many of them are focused on lifestyle intervention that can improve longevity and quality of life. Sauna fits in this category as well. I live in America, but in other countries, especially Norwegian countries, sauna is very popular. Some of the big studies that investigated the effects of sauna come from Finland, for example. As I've learned about health benefits from certain type of activities, I often try them myself, and I started implementing sauna a couple of months ago in a trial just to see how I felt using it for my own personal health. In America, the way we often do sauna is a small room with a heater in it. It's common for you to have short-term exposure to temperatures that are around 174 degrees Fahrenheit. In studies, I saw a range between 113 and 212 degrees Fahrenheit. Short-term exposure to sauna, and then sometimes interspersed with cold therapy, such as getting in a cold bucket of water or a cold bath or cold shower or rolling in snow, and then subsequently going back into the sauna seemed to be a common practice. Looking at Finland, not that I've been there, but looking at the way they use sauna, it seems like they also intersperse cold therapy with their sauna treatment as well. I'm coming back to Finland as this country seems to have sauna ingrained in its culture, and that allows for study of its population on health benefits. So temporary exposure to heat, followed by cold, followed by repeat heat, sometimes 5 minutes, sometimes 20 minutes in the heat. It looks like there is no specific definition, but often 15 to 20 minutes is cited in some of the studies that I've reviewed. In my study, I also learned that Japan has a therapy called WAON therapy, where they're exposed to infrared sauna at a little bit lower temperature, maybe 140 degrees, for similar duration, and then afterwards they lay on the ground with warm blankets on them and then repeat the cycle. When I've used sauna, I've noticed that I do have decreased muscle tension and relaxation fairly immediately. There are many other mechanisms by which sauna can help you, and I have listened to podcasts, watched videos, and reviewed articles that address some of these mechanisms. I'm going to review some of these mechanisms, but not go into real deep specifics on the article findings, as that can be boring. So a brief overview of some of the benefits at a molecular level from sauna include decreased blood pressure, improved endothelial function. The endothelium is the lining of your blood vessel that helps to regulate how wide or how narrow the blood vessel is, as well as adhesion of the blood vessel wall to substances that are circulating in your blood. Sauna seems to improve the parasympathetic aspect of the autonomic nervous system. In other videos, I've talked about this for mental health benefit as well as cardiovascular health. Studies have shown decreased arterial wall stiffness as well as thickness related to sauna. They have also shown decreased levels of BNP, which is brain natriuretic peptide. High levels of BNP are associated with adverse cardiovascular outcomes in congestive heart failure. You may notice the collection of things I mentioned relate to decreased cardiovascular risk. Cardiovascular risk is the number one concern in America. Many of the benefits of sauna seem to mimic what you would get from vigorous type of aerobic exercise. Any talk about sauna should also include a discussion about heat shock proteins. Heat shock proteins are activated by heat stress, which is something that sauna creates. Heat shock proteins have the job of repairing misfolded or damaged proteins in your body. Theoretically, heat shock proteins could have anti-aging capacity based on their function. Sauna increases production of the cytokine interleukin 10. Interleukin 10 is something that has been given to patients with depression, and big improvements have been noted in their depression scores. The increased interleukin 10 expression related to sauna use may be helpful for depression. It is felt that repeated sauna use also increases expression of mu opioid receptors. These are important in regulation of sense of well-being, decreased sense of pain, basically endorphin type reactions. Some of my other videos have discussed this type of phenomenon, such as my video on low-dose naltrexone. So if you want to learn more about this, you can access one of those videos. In studies, sauna has been linked to increased immune system function and decreased risk of infection. One study I viewed showed 27% reduced incidence of pneumonia. Sauna also appears to stimulate the genesis of mitochondria. Mitochondria are the organelles in your cell that help to produce energy. So one would think that this might help have anti-aging effect and also improvement in energy production and efficiency. I read a journal article from the European Journal of Epidemiology from 2022. I'll read the title: Inflammation, Sauna Bathing, and All-Cause Mortality in Middle-Aged and Older Finnish Man, a cohort study. In this study, they followed about 2,500 men who are aged 42 to 61 over up to 25 years. They had two groups of people, those who use sauna 2 times or less, or those who use sauna 3 times or greater per week. And in the more frequent sauna users, they noticed decreased all-cause mortality risk as well as decreased high-sensitivity C-reactive protein. High-sensitivity C-reactive protein has often been linked to inflammation and increased risk of many health problems. Other studies had similar findings with decreased sudden cardiac events and decreased risk of cardiovascular death in frequent sauna users. It looked like the all-cause mortality was reduced by about 40% compared to those that were not frequent sauna users. Another observational study in Finland showed a 65% decreased risk of Alzheimer's dementia in frequent sauna users. Quite an impressive result, since Alzheimer's dementia is such a terrible condition and is so prevalent today. I saw another study from the American Journal of Hypertension from 2017, and it was titled Sauna Bathing and Incident Hypertension, a prospective cohort study. They demonstrated a 23% decreased risk of hypertension in those that use sauna 2 to 3 times a week versus 1 time a week, and a 46% decreased incidence of hypertension in those that use sauna 4 to 7 times per week. Another article from the journal Complementary Therapies in Medicine from 2019 was titled Recovery from Sauna Bathing Favorably Modulates Cardiac Autonomic Nervous System. In this study, they looked at parasympathetic activity, heart rate variability, and heart rate. It showed that sauna use was related to improved autonomic function, heart rate variability, and decreased resting heart rate from 77 to 68 beats per minute. I read an article out of the European Journal of Applied Physiology and Occupational Physiology from 1989. The title of this article was Hemodynamic and Hormonal Responses to Heat Exposure in a Finnish Sauna Bath. And without going into the methods deeply, it looked like there was between a 5 and a 16-fold increase in growth hormone secretion with sauna use, depending on the exposure and the intensity of exposure. Growth hormone has benefits on anti-aging as well as muscle building. Briefly, I wanted to touch on the safety of sauna. In men, it has been shown to decrease fertility with frequent sauna use. However, this is mostly reversible within 6 months of stopping sauna use. In women, there's theoretical risk to the fetus, and therefore I would not recommend sauna. Alcohol use and sauna do not mix. If you've had a recent heart event or have severe aortic stenosis or just unstable angina, sauna use is ill-advised. Anyone with acute illness, it just makes sense to avoid sauna. Certain medications can increase your risk when using sauna, such as diuretics, barbiturates, lithium, anticholinergics, beta blockers, and antihistamines. Sauna seems safe for most people. Of course, there are other alternatives to sauna that provide heat therapy, such as warm blankets, electric blankets, hot water baths, hot tubs, and infrared lamps. I don't have enough information to rank these other heat therapies to sauna as far as effectiveness goes. For myself, I've been using sauna after my workouts and then following that with cold shower therapy. I haven't been doing this long enough to know if this is benefiting my physiology, such as my vital signs or any type of blood markers. I know I feel better when I use sauna. I know I have plenty of energy throughout the day. It is nice to have articles and studies that show benefits with sauna. If these articles are wrong and there are no benefits, at least I get the benefit of being in the sauna and feeling good, feeling relaxation, and improving my muscle function and recovery. In a lot of my other videos, I focus on things such as lifestyle interventions related to diet and exercise. I also discuss longevity and quality of life. When you look at studies, there are many other factors that can be a confounder, and if you see plenty of people trying to be healthy, they may be trying to be healthy in many other areas of their life, which can skew study results. The articles and studies that came out of Finland, though, are interesting because it's an important part of their culture, and many people use sauna. This spans many socioeconomic classes. So it makes me think there is probably some value there. To me, it's fascinating that sauna can mimic exercise. For those people that are unable to exercise due to a disability, a functional problem, this may be an option for them. The benefit of sauna is that it does increase heart rate, it does improve vascular tone, as well as possibly even mental health. If you are my patient, I hope you found this information useful. If you are not my patient, you need to see your own doctor for your diagnosis and treatment plan. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life. Take care.